But I think going right back, there were some very early attempts. We still have an original copy of the Wagner lengthener in one of our offices, and this was a monolateral type device where you would just use the thumb screw to actually lengthen the leg. It sort of worked. You got some form of bone, but the principles at that point were really just plating after you'd got some form of callus, and there wasn't really much in terms of strength, but they did eventually heal through, but not without their complications. But being a monolateral device, there were issues with the biomechanics and the callus formation, and so better implants really were needed. It's really this chap, I think, who started, and this is Giovanni de Bastiani from Italy, who popularized and was heavily involved in setting up Orthofix and the DAF, or dynamic axial fixator. And my prof when I was a fellow, Mike Sarley, was very heavily involved and was actually one of the co-inventors of the Sheffield hybrid fixator, which was actually a half-pin fixation system coupled with the tension fine wires. They were quite chunky wires, and the tensioning was actually quite significant. But we, through a lot of my time as a fellow in 2003, we were using quite a few of these, and using the what would now be fairly well established the minimal invasive corticotomy and slow distraction with callus formation and then stabilization. There was a fairly reliable result that could be achieved, and quite a number of patients were then had this treatment. And there was, during this period, quite a lot of limb lengthening, particularly in achondroplastics, and Prof. Seiler was quite heavily involved in that. This has really gone out of vogue now. We do very few pure lengthenings now, actually. And the sort of the treatment aims really now is more in terms of alignment and tensioning of collateral ligaments, for example, around the knee. But the Orthofix equipment was used quite extensively, and I think my personal favourite in my year as a fellow was what I came to nickname the Sarley Superframe. And this was quite an elaborate and extensive frame that was being used to correct patella baja at the time, along with a number of other problems. However, moving on from there, all these pictures seem to have a very common theme running in them. On the left-hand side, with Prof. Sharad, Leo Donnan, and my senior colleague, James Fernandez, really has been sort of the main instrumental driver of a lot of what's been done here at Sheffield in recent years. And he's been quite prolific in research and publication. And I've considered myself very fortunate having such a sort of gifted and very helpful mentor as well over the years. When I was a junior doctor, James was the fellow. And when I became the fellow, he was my consultant alongside Prof. Sarley. And we've, in Sheffield, done quite a number of different types of cases, including osteogenesis and using the calotasis techniques with all sorts of different frame constructs, which I'm sure Sanjeev will be going through in more detail. But just to give you a flavour of the sort of indications that we've actually been involved in, the achondroplastics, as I mentioned earlier, we're not really lengthening for pure cosmesis now, but we are correcting varus, and we also use a tether tensioning technique where we differentially lengthen and tighten the lateral collateral ligaments, which really does help improve the knee joint laxity. Bifocal treatments are often involved, and tibial correction in terms of the overall axis and ankle. Post-meningitis has been one of my cases, and there's a variety of constructs that have been used over time. This young lad is actually another of James's patients, so we've had experience in upper limb lengthening post-meningitis. He's actually training to be part of the British Paralympic team. I think James seems to accumulate swimmers, because this is another of his who's actually in the British Paralympic team. I include this not so much to show limb lengthening, but actually just to highlight, I suppose, that over the years, the use of fixators and the implants that are available has changed. And again, my colleague will probably touch on this in due course. But the use of guided growth is increasingly popular, and years ago this could easily have been 4 external fixators achieving something similar. So things have changed over the years. All sorts of Ilazarov and other constructs have been used in terms of the methods. And I'm just highlighting a number of these over the years. In total, I think we've done almost over 3,000 different frames and constructs and treatments. And it is a changing landscape, though. We have the implants and indications for leg lengthening are changing. And the number of actual external frames we are using is reducing, though, in favour of other devices. But we do continue to be quite active in this in terms of the limb lengthening and correction for both congenital and acquired conditions. But it is a team effort, and it's not just the surgeons. And we have physios, nurse specialists, and the gentleman in the blue top in the middle there was actually one of the longest members of our team, working right alongside Prof. Sali, and has been with us for a number of years, Jonathan Pagden. You do need that multidisciplinary input, though. So we need we have access to psychologists, the nursing care, and the nurse specialists and physios. We have ward and pre-assessments prior to surgery. We have patients' information and counselling packs, and there's quite a wide support, parental support groups as well, so that we can individualise the treatment for these patients.